Can prednisone delay your period? Hi, I'm Dr. Megan, your prednisone pharmacist, and I've been asked many times what prednisone does to a woman's period. So I'm here to answer that question and many more. At the end, I will go through a list of frequently asked questions about prednisone and women's periods. And then after that, I have a special case study. I went through a specific woman's question and specific things she can look for and optimize in her life to maybe not have to deal with the side effects of prednisone quite so much. So, first, can prednisone delay your period? Yes, prednisone can definitely affect your period. And this is really confusing because you might be taking prednisone because it's being prescribed to save your life. It was being prescribed to save my life, or it's being prescribed for inflammation or maybe an autoimmune condition. And you're wondering, why is something being prescribed to save my life affecting my period? Prednisone is affecting women's periods for several reasons. First of all, the molecule of prednisone actually looks a lot like the steroid hormones that your body uses to regulate your period. So prednisone looks like progesterone and prednisone looks like estrogen. It's structurally and chemically similar. They are related biologically in your body. And so when you're making one go high, it can kind of throw off the balance of your other hormones. Next, prednisone is mimicking the hormone that your body uses to cope with stress. And I'm not talking just like, oh, I'm stressed out. I'm talking stress that is life-threatening. So when our very distant ancestors were dealing with a famine and there was no food for a long time, or war, when life was treacherous and Mother Nature didn't know for sure whether or not if you got pregnant, that baby would survive. Or if you got pregnant, you'd have enough food to support a pregnancy. And so Mother Nature designed cortisol, that hormone your body deals with stress with, to affect periods. That when, for example, during World War II in Poland, when people had very little food, they did a study and found that there was much less fertility. Was it because people weren't making babies, or was it because women weren't ovulating and able to have actual pregnancy? And they did studies later on, and it's fascinating to see that Mother Nature knows when, by the signals we're giving our body, it's a good idea to get pregnant and when it's not. And so naturally, she's downregulating our ability to get pregnant, affecting our ovulatory and bleeding mechanisms so that they're just off balance while you're on prednisone, especially while you're on high doses. So how soon can this happen? Well, if you get one super duper high dose, that alone could affect your period. Or if you're on relatively modest doses for a short period of time and then you go off, you might have noticed a change in your periods. It really, even one dose, even a low dose, can affect your period. So it's not something that's very predictable, and it's not very common, actually. This side effect of prednisone is not something that every woman experiences. It's more rare and it is not predictable. So you might have a delay in your period, but your best friend, if she took the exact same dose, might not have a delay in her period. So how much of a delay are we talking about? Well, that's also pretty well undefined. Nobody really knows for sure, and it's really individualized. So one person might have a 2-day delay in their period. Other people might completely miss their period. And those aren't the only changes that can happen, though. I'm going to go to the question and answer about what changes are possible and answering the questions many people have asked. First, how long can prednisone delay your period? So generally, prednisone delays your period while you're on it and maybe like one cycle later. It doesn't normally delay your period forever. And for like one period, it might delay it by 1 to 2 days or a week, or you might skip it completely. And so it's while you're on it, and it's usually a short-term thing. Okay. Second, can a woman get pregnant while taking prednisone? Yes, a woman can definitely get pregnant while taking prednisone. Lots of women are still ovulating and menstruating completely normally while taking prednisone. And so, yes, it is possible to get pregnant while on prednisone. And is that concerning? Or should you be terrified? And is there a big problem there? The American College of Obstetrics and Gynecology, the doctors who take care of pregnant women, plus the doctors who take care of babies, the American Pediatric Association, have both said that if a woman needs prednisone while she's pregnant, that the benefits of that treatment are greater than the risks to that unborn baby. And so if you have asthma and you're not breathing, the loss of oxygen that you're going to have by not treating your asthma is going to be worse than whatever potential side effects might come from the prednisone. And they're generally very supportive of women taking prednisone while pregnant. So you shouldn't feel super concerned about that. Can prednisone stop your period? Yes, prednisone can stop a woman's period. And it's usually short term. It's usually not a long term, like, oh, I'm suddenly in menopause. It's usually a temporary thing that is while you're dealing with this stressful event that is taking prednisone. Can prednisone cause heavy periods? Yes, prednisone can cause heavy periods. Again, prednisone is affecting your hormonal balance. And so you might not have as much progesterone there to lower your heavy periods. You might have a change in your estrogen. Either of those things can affect the amount of blood flow during a period. And so it can affect how heavy your periods are. And related to that, can prednisone cause a period after having stopped having periods postmenopausally? Yes. I have heard from many women who are menopausal, have stopped having periods, and are suddenly having bleeding postmenopausally. Prednisone can definitely affect whether or not you are bleeding normally or at all after your periods should have stopped. Can prednisone make your period late? Yes, prednisone can definitely make your period late. We don't know exactly how long. If you are concerned with any of these changes, feel free to get a pregnancy test, talk to your doctor, but it is an expected and possible side effect of prednisone. Can prednisone make your period come early? Yes, prednisone is affecting your period. It's affecting your hormonal balance, and it can cause your period to come early. You might have a shorter cycle than usual, or you might have a longer cycle than usual. That would be the period coming late. Either are possible while on prednisone. So now I'd love you to watch this video I recorded before, specifically for one woman, all about what she could expect when she was taking prednisone, and it's been a year. So check this out.
I was on 60 milligrams of prednisone daily for uveitis for 8 months, from March until November of 2022. Almost a year later, I'm still having intermittent bleeding and longer periods. Is this normal? My prednisone doctor assured me that the steroids were the issue, and I know that all of my tests are normal, but is there anything I can do? Should this still be going on? This is a great question. So basically, can prednisone cause issues with periods and bleeding? And if so, when does it go back to normal, right? So first of all, yes, prednisone can cause hormonal changes that can cause amenorrhea, which means no periods, heavy periods, or more infrequent periods. It can change the timing, the length, the everything. Basically, prednisone is structurally, like chemically related to our sex hormones. It's only a few molecules different from testosterone and estrogen and progesterone. And so if there's some genetic issue when you are getting really high related cortisol levels because of the prednisone, it can do something different to your progesterone or your estrogen levels, which would affect your bleeding. Now, I'm not a gynecologist, and I don't know how old you are. If you were in your mid 40s, I would say the intermittent bleeding and longer periods could be perimenopausal symptoms just setting in. If you're in your early 30s or 20s, then this is a much more concerning and surprising thing. But if your doctor said your steroids were the issue and your tests are normal, that's good news, that there's not another reason that you're bleeding. But as far as having intermittent bleeding and longer periods, there are things you can do. And some include having hormonal supplementation, whether it's taking a birth control pill, not necessarily for birth control, but as a replacement of your body's hormones so that it regulates you, that's a possibility. I don't necessarily recommend it. I don't really want that for myself. I don't want that much hormonal exposure. In addition, you could try bioidentical progesterone. It's like a prescribed capsule, and they can do anywhere from 50 to 200 milligrams per day, and that can support your periods, the bleeding. And it can be just in the last half of your cycle. So, like day 1 is the first day of your bleeding, and you might take progesterone capsules by mouth on days 14 through 28. So, basically, the last 2 weeks before you start bleeding, that's a possibility. And it's, only one hormone instead of 2 hormones that would be in birth control pills. And it's the same type of hormone that your body is making, the progesterone itself. So that's generally a good option. And should this still be going on? Not necessarily. A year later, it could be from the prednisone a year later, but I don't know. I haven't heard of that necessarily. It does do weird things, but it's generally while you're taking the prednisone. And so normally prednisone doesn't cause permanent changes to your menstrual cycle. Normally a transient temporary thing. And so I don't know if it should still be going on, but generally it shouldn't still be going on a year later. Taking hormonal therapy can support you. And then one more thing that might possibly help is inositol, myo-inositol as a supplement might help in getting a more proper balance of hormones and a better rhythm with your periods. And I love Aviva Romm and her book Hormone Intelligence. You could try that too.
Signing off is Dr. Megan, your prednisone pharmacist.